Universities, health organizations, everybody that I've encountered in my former career as a pharmaceutical executive are out there with their hands out. You know, everybody's begging for money. Nobody has any money. The government doesn't have any money. Universities don't have money. Nobody's money. The only ones that have money are these big multinational corporations. And they have lots of money. And they use that money to basically buy influence. And the way it's done is, number one, you give these organizations and institutions grants for various kinds of research. You do develop research together with them. You establish friends. You make sure that they become beholden to you. And you also pay individual professors and doctors and researchers directly. You may pay them as speakers to travel around the country, $1,000, $2,000 per day, sometimes more. You give them money for programs, the educational programs where they can make a profit, and then they put on these programs, and they're supposed to be third-party, independent from the company, which is all fine. But as you and I can both imagine, if you have a promotional budget at a corporation, you're probably going to give that money to the universities that do the programs that most support your drug. And the ones that don't, or are critical in any shape, way, or form, they're not going to get anything. And everybody obviously knows that this is how things work. And that means that even if you can officially claim, well, this is arm's length, we didn't have anything to do with it, we just gave them a grant, they can do whatever they want with it. Reality is, they're not going to continue to get money unless they're saying what you want them to say. They know it, you know it, it's only maybe the public that doesn't know it. And that's how you influence the medical establishment, simply with money.
The whole public face of vaccination has changed, and a large part of that change has been due to the involvement of private individuals. In 2010, the Bill and Melinda Gates Foundation donated $10 billion, with a B, US dollars, to make 2010 to 2020 the decade of vaccines. When this announcement was made in 2010, when I was just starting to wake up to the issues with vaccination, I had no concept of what $10 billion could do. But today, with that plan in action, with all that money, the vaccine stakeholders have planted flags everywhere, with some startling results. In 2015, the focus in the United States was on making vaccines mandatory for all people, and they were successful in some places, making vaccines a lifestyle event for all people from cradle to grave, and broadening the appeal of live viral vaccines for their immune system benefits, not just for their disease-preventing benefits. The World Health Organization's strategic plan was printed first in 1993, and then it was updated in 1997. And it morphed into the global immunization vision and strategy, which Bill Gates often makes reference to in his publicity. And you can see it right here in that last paragraph, the Global Alliance. Today we have a computer software billionaire, the pharmaceutical industry, academia, and the US Department of Homeland Security, and the World Health Organization, all speaking and working in unison towards the same goals. These alliances should have anyone who listens and watches asking lots of questions. Because the goals are to restrict our health freedom, to censor what we read and can say, and remove our ability to choose what goes into our bodies.
One issue that really grabbed me as urgent were issues related to population, reproductive health.
But did you come to reproductive issues as an intellectual?
When I was growing up, my parents were always involved in various volunteer things. My dad was head of Planned Parenthood, and it was very controversial to be involved with that.